The government has today added a new category of Kenyan residents who are 58 years and above to the list of persons to be vaccinated in the first phase of the COVID-19 vaccination program. Now, that announcement coming a day after India reportedly put a temporary hold on all major exports of the AstraZeneca coronavirus vaccine made by the Serum Institute of India to meet demand at home as infections surge. The decision will affect supplies to the COVAX vaccine sharing facility, through which more than 180 countries are expected to get doses. Raquel Moigai gives us more details.
The world's largest vaccine maker has for the last few days delayed exports of the AstraZeneca vaccine to various countries, including the UK, Morocco and Brazil. Reports indicating that the last shipment was made on the 18th of March. And now the decision to temporarily hold all major exports has left countries dependent on the Gov't WHO-backed COVAX vaccine sharing facility at a loss on when their next supply of the vaccine doses will be. India's decision, informed by the surging numbers of COVID-19 cases that have seen authorities order people to remain indoors in some towns in western India as the number of new infections hit 53,476 infections overnight, the highest in 5 months. According to Dr. Rudy Eggers, the World Health Organization representative in Kenya, the decision has not been communicated officially to them through COVAX. Therefore, it is difficult to plan. However, if that is the case, Kenya still has a long way to go with the dose available in the country before India starts exporting again. In March, Kenya had received 1.02 million doses of the AstraZeneca vaccine from COVAX and another 100,000 doses from the Indian government. Another 2.5 million doses were also expected in April to boost availability as Kenya continued with its first phase. Early on Thursday, the Ministry of Health released a statement indicating it had prioritized vaccinations of persons aged 58 years and above. According to ministry data, this category of persons is most at risk of severe disease and accounts for 60% of the country's recorded deaths. India's decision is, however, raising questions on whether Kenya is able to ensure that every person who gets the first dose will receive their second dose after 8 weeks. Dr. Rudy Eggers says the World Health Organization recommends that everyone gets the same type of vaccine for each dose, as there is no data on the compatibility of the various vaccines. Kenya is, however, looking to authorize the use of other vaccines in the country to help deal with the COVID-19 third wave that has led to the death of 26 people recorded in the last 24 hours, raising the total number of fatalities to 2,092. The Health Ministry saying 23 of these deaths are late declarations, with only 3 happening in the last 24 hours. Within the same period, Kenya has registered 1,463 new infections out of a sample size of 8,976. That is a 16.3% infection rate. Raquel Moigai, Citizen TV.